Hello, thank you for tuning in. My name is Felix, and today I will be talking about therapies, more specifically the different approaches to therapy and the origin of it. For those who kind of want to jump around a bit, I've created a table of contents here with slide and title numbers of one. So if I like to jump around, I'm going to try to annotate it when I put it in YouTube to make it a lot easier to navigate, so each number will be assigned to the slide number as well. So to begin, what is psychotherapy? Psychotherapy or talk therapy is a way to help people with a broad variety of mental illnesses and emotional difficulties. Typical problems helped by psychotherapy include difficulties in coping with daily life, the impact of trauma, medical illness or loss, like the death of a loved one, and specific mental disorders like depression or anxiety. Typical sessions may be conducted as an individual, a family, a couple, or in a group setting, and they can help both children and adults. Most sessions are about 30 to 60 minutes long, and both patients and therapists need to be actively involved in the psychotherapy in order for it to be very effective. Now on to the origin of psychotherapy, psychoanalysis. It is a term that was coined by Sigmund Freud in 1896, and for the following 40 years after his discoveries of psychoanalysis, he had worked very hard to develop main principle and techniques to better its understanding. The main principle of psychoanalysis was to define the importance of unconscious mental activity and then find a connection between it and the conscious brain through certain things like dream interpretation and free association. Dream interpretation was involving digging into the meaning of dreams, understanding their purpose and reasoning, and trying to tie them to potential issues that people experience in daily life. While free association involved manipulating some sort of mental process where a word or an image is suggested, and then the patient in turn tries to suggest another. And something very common that most people understand are these ink blots like you see in the bottom right corner, where the therapist would ask what they see, and based on the answers that the patient gave, the therapist could possibly come to some conclusion. Through the many years of psychoanalysis, it has branched out to many different kinds of therapies. However, overall, each branch can be condensed down to this kind of process until it finds a solution. Starting from the left, we have insight therapy, which is the beginning stage when dealing with a disorder. And at first, the therapist needs to identify the patient's problems, understand their motives, and then know what actions need to take place. Then they can attempt to find a solution or a coping mechanism. If simply discussing the matters in a private setting is insufficient, then we have to move on to the next part, action therapy, which consists of techniques to change behavior, whether it be through scare tactics or positive reinforcement. This stage involves changing actions based on emotions and suggestion. If the action therapy is insufficient as well, most patients will end up in biomedical therapies, which is also known as assisted therapy, which through the use of non-invasive means such as drugs or stimulants to alleviate the symptoms of the disorder. This type of therapy is used in combination with the other two types for maximum efficiency. The most notable branches and approaches to therapy as listed are humanistic therapy, behavioral therapy, and integrative therapy. Each approach has different branches beneath it as it can be used in different ways. Beginning with behavioral therapy, this is an umbrella term for types of therapy that attempt to change unhealthy behaviors. Some of the most common techniques used to eliminate bad habits are system desensitization, aversion therapy, and classical conditioning. Desensitization involves overexposing the patient to the fear or phobia and triggering a neutral or positive response in order to inhibit or alleviate the phobia. This doesn't have to be as grand as a phobia to be effective. For example, if somebody has anxiety when talking to or approaching women, that someone can expose themselves to more and more women over time and try to become more comfortable in the situation, to the point where they don't have anxiety anymore. Aversion therapy involves connecting the problem with an unpleasant stimulus. For example, someone who is an avid smoker who wants to quit can attempt to create a negative stimulation when wanting a cigarette. For example, it's not a very good example, but if every time the smoker reaches for a cigarette, he receives a painful shock, over time he will begin to associate smoking with the shock and want to smoke less and less because of the negative stimulants. And another technique, which happens to be one of my favorites, is classical conditioning. Classical conditioning is a learning process that happens when two stimuli are paired together as a response to the first, eliciting the second. As an example, I have a clip here from the show The Office, where Jim uses classical conditioning on Dwight. Moving on to cognitive behavioral therapy. This form of therapy is seen more as the positive side of behavioral therapy because it focuses more on identifying the disorder and then encouraging the patient to challenge the cognition, change their patterns of behavior, as opposed to trying to create negative stimuli to scare us from the disorder. The patient embraces it and attempts to fix the problem head on. A commonly used symbol are the 3 C's, which stand for catch, check, and change, which refer to the steps that the patient should take in order to overcome the cognition. Catching the pattern of behavior, check to see if it's an appropriate response to the situation, and if it's not an appropriate response, then you take action and change it so that when similar situations occur in the future, your mind will act properly for you. Sticking to a similar positive approach would be Humanistic therapy. This form of therapy is referred to under the same insight therapy branch. The goal of this therapy is to promote the psychological wellness of the patient by bringing attention to their underlying motives, strengths. There's more of an emphasis on equality with the patient rather than a deficiency or disorder. For example, saying that, we can work on this together and you can get better together, as opposed to having something that just seems to weigh you down, like depression or anxiety that just never goes away. The therapist is always pushing the patient toward a more self-fulfilling role, rather than just putting a piece of tape over a cracked pipe, so to speak, something more long-term, self-fulfilling, as opposed to, we'll just fix this for now. This form of therapy is typically used with people who have low self-esteem, or who are having trouble finding their purpose or reaching their maximum potential in life. Another description would be for someone who's not comfortable with themselves or does not feel whole as a person. The two main underlying branches to humanistic therapy are Gestalt therapy and existential therapy. They are fairly similar, but the main differences are that Gestalt therapy focuses more on the importance of being here and now and accepting responsibility for your actions and you as a whole. While existential therapy focuses more on the self-fulfilling idea, where we have the free will to do what we want, and therefore to fill, we must search for our own meanings in life. The final approach I will discuss today is holistic therapy, also known as integrative therapy. This form of therapy attempts to implement as many of the other previous therapies I discussed together to best fit their patient. It is similar to humanistic therapy because the overarching goal is to make themselves whole, but the main difference is that the awareness and meaning come more from the connections between emotional, physical, and spiritual experiences. With guidance from the therapist, the patient can try to piece together each component to reach the overarching goal of greater self-awareness, self-esteem, self-acceptance.